The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
California, welcome to another Ask the Expert show, where for the last 17 years we have brought you the finest experts in the field of legal, health, financial, and home improvement. I think what's so great about our show, it doesn't sound like a info commercial. I mean, we truly give out the greatest educational information on topics that we know you want. I got to tell you, God works in a funny way. We had an opening in California, and I said, oh my God, there's thousands of agents in California. I've become very good friends with our expert today, Stephen Fromm. And for some reason, because he's in New Jersey, for some reason I shared it about California. And I mean, he didn't take 2 seconds and he told me I want California because he's licensed in so many states. Let me welcome my friend, Stephen Fromm.
Good afternoon, sir. How are you doing today?
Well, you know how I'm doing.
Yes, I do. And you know how I am doing as I sit here in my hotel room in Richmond, Virginia. So halfway home to New Jersey.
You have been doing some major traveling the last, I guess, week or so. So what I went through this morning is nothing compared to. Listen, if you see me squinting, just so you know, I mean, it's not any big secret. I had cataract surgery this morning, and I'm like in one eye. That's what I can do. But hey, this show is so easy to do. We've got your questions, Stephen. With all these new people, tell people about your company.
Sure. Again, I appreciate it. My first name is Stephen Fromm, and I am the owner of Fromm Insurance Services. We have been in existence for, God, I've lost track how many years. And we specialize in helping families with their Medicare enrollments. Our primary goal is when we work with families, after we do our client needs analysis, we want to make sure that they help them make educational, informed decisions regarding their Medicare. Something that I actually put together this morning when I was thinking about it, talking about with my son, who's an investment advisor. We talked about his investment portfolio that people have. And I said to him, I go, wow, people should have healthcare portfolios then.
Oh, yeah.
I said to myself, what a great idea. Families should have healthcare portfolios, not just have your original Medicare, Part A, Part B, maybe a Medicare Advantage plan or original Medicare with your Part D. But what about that cancer, heart attack, stroke, or the home care, or the recovery care, or the dental care? That's all part of your healthcare portfolio. And it was really interesting conversation with my son because he was like, Dad, that's a great idea. Everybody should have a healthcare portfolio, not just an investment portfolio. So I'm going to go with that's what we strive for. We strive to help build healthcare portfolios for families to protect them against, as you know, what just happened with me, with my mom. Yeah. As I say in all my presentations, acute events in life just happen. And when those things happen, you need to learn how to pivot and make changes. So this is a new audience, so I'll just go quickly. But I was on a family vacation in Mexico, and next thing you know, my mom calls me and she suffered a severe injury needing reconstructive surgery. And I had to get from Mexico to Hilton Head, South Carolina. And we did that in a whopping 30 hours and 3 plane rides later and 3 hours of sleep. But the big part about this conversation is how I had to advocate for my own mother to make sure that Medicare was going to cover her surgery. Because my mom had such a severe injury, she went through the emergency room and they were treating her as an outpatient. And because they were treating her as an outpatient and observatory stay, that would not count towards her 3-day qualifying hospital stay. And I had to battle for 3 days and advocate for my mother to get her to become an inpatient. I had a battle with the social workers, unfortunately, I'll use the word battle, because they would not classify my mom as being inpatient. Even the day of the surgery, she was not classified as inpatient. She was classified as outpatient. And I was being told that she would be an outpatient and that my family would have to pay for skilled nursing out of her own pockets. And unfortunately for the social worker, she didn't know that I was a licensed Medicare agent. And I explained to her how it was going to happen. It was going to happen the fact that I'm going to get the doctors involved and we are going to get my mother admitted to the hospital so she can have her 3-day qualifying hospital stay. And now she's in skilled nursing after that qualifying hospital stay. And this will be covered by Medicare now. Going to skilled nursing. My mom has original Medicare. As we talk about the first 20 days being free, but after that, there's a per diem, and my mom has original Medicare, and that will be covered. I had to advocate for my own mother, the fact that to become an inpatient. And here's the funny part. The night of her surgery, she had surgery in the morning, that particular night, she was still considered outpatient. After having surgery, they still considered her to be outpatient. I had to battle with the doctors, get them all involved, and her 3-day qualifying hospital stay did not start until the day after surgery. So we had to wait all those days, and she had been in the hospital since Monday. So Monday, Tuesday, Wednesday was her surgery on Wednesday. So 3 nights never counted. We had to start the hospital stay on a Thursday night after the surgery. And I'll talk about the fact that what we bring to the table now is when I work with families as their trusted advisors, we're here to help you advocate, because I will say this as a good doctor friend, Medicare is great, but the system is broken. The system is broken, and unfortunately, families will need to advocate. Now, if a family that didn't understand Medicare, they may have just have accepted the fact that their loved one was going to be outpatient, and they were going to have to pay for skilled nursing at $500 a day, $15,000 a month, could be there 2-3 months. That family wouldn't know. And the greatest thing about working with me and our company is that I do know. And I'm here to help advocate for the family. And as you and I talked about yesterday, one of the most powerful tools that I had in my pocket was that I am the power of attorney for my mom. And I will tell everybody right now that's listening, for your loved ones, you need to go get your power of attorney. You need to go get your durable power of attorney, not just medical, but financial. I had that in my pocket. And once I produced that document, everybody was talking to me. And without that document in my hand, I would have been in trouble. I would have not been able to.
Even that was the show before yours was our New Jersey estate planning show. And we talked about that, how important that is.
Yep, I did that. Unfortunately, my dad passed away 5 years ago. We did that. And if I did not have that, a very important document, I would have not been able to advocate for my mom. And we would have been in a very difficult situation. And I'm a licensed Medicare agent. I mean, I had to get 3 doctors involved.
What the out-of-pocket costs would have been if you hadn't been there?
It would have been $500 a day. So it would have been $15,000 a month. And they're telling my mom she's going to be there for at least 8 weeks. So that'd been $30,000 out of pocket, just like that. And, you know, again, unfortunately, the social worker was a little surprised when I told her I was a licensed Medicare agent and this is not how it's going to go. we're going to change what the CPT code is in the system, and we're going to get my mother classified as inpatient. But as you think about this, my mother had surgery on Wednesday, reconstructive surgery on her ankle. To give you an idea how bad she fell, she has a plate and 12 screws in her ankle. And this is an 84-year-old woman. Has a plate and 12 screws. That's how bad this fracture was. And so think about, she had surgery on Wednesday morning and stayed over Wednesday night, and they still thought she was outpatient. How does that make sense? The system, unfortunately, is broken in that regard. And, again, advocate for your family. That's what working with our agency, we're there for you. We're your trusted advisor. Things may happen and you may not understand it. That's why you pick up the phone and you call me, because I know what to do. I know what to say. And I think that's what brings the value added proposition to working with someone like myself, maybe with someone else, because we're going to go that extra mile, as you always talk about.
Stephen, I was thinking about your show this morning while I'm laying on a hospital bed, and I'm sitting here thinking about your show. And I break it down into three parts. The first part is, there's people who are under Medicare now who have an agent, and maybe they don't think, it's all being taken care of for them. I was one of those people. And I got to tell you, folks, even if you've had an agent in the past, I am telling you, and this is going to sound like a commercial, but I don't care, is you've got to have not just an agent, you've got to have a great agent. And I've done something that I've never done in 17 years because I don't ever want to show favoritism. Stephen's company, knowing what I know about Medicare now, I said, I've got to have him on my side. And Stephen's my agent now. And I've never done that before. But I'm bringing that up because there's agents and then there's agents. And Stephen I am telling you, he covers our Florida market, our East Coast, all of our states there. This is our California show. Remember, the government's involved and how crazy they make things. You need somebody who's going to direct you. And what I love about Stephen, he's got so many companies he represents, and he's going to show you several plans, not just one.
Correct. I'm an independent agent. I'm not a captive agent. Captive agent works for one particular carrier. As an independent agent, I work with, I think it's 25 different carriers right now. And I'm able to, after we do the client needs analysis, and I understand what's important to you, what your healthcare needs are, and, and what basically just makes sense for you, we're able to look at various carriers to decide, which carrier is going to be best for your Medigap plan, which carriers are going to be best for your dental insurance, which carrier is going to be best for your cancer, heart attack, stroke plans, recovery care plans, which again, the recovery care are similar to long-term care plans. That is a recent product that's out there. And, that helps after that 100 days of skilled nursing. Perfect example. After 100 days of skilled nursing, nothing's covered. So you better have your recovery plan. If you don't have a long-term care plan, you need to be talking to me about recovery care or home care. Maybe you don't want to go to skilled. So I'm able to look at all the different carriers in your zip code in your area and find out which carrier is going to work best for you. And that's really the advantage that we have, working with us, as well as, the knowledge. Fortunately for me, I've had great life experience and I have a lot of knowledge. And, I've had some very, very good teachers in my life that have provided me with this knowledge. And, just becoming friends with all of my clients. My new VA, Jackie, said to me just this morning, she's like, you're friends with all of your clients. They're not just clients, you're friends. Like, all these personal things. I go, yeah. I know the guy who actually, one of my guys, he's basically deadliest catch. He's a crabber, like deadliest catch. I have another guy who's a professional blackjack dealer. I know everything about these people. So when I speak with them, our conversation is not just Medicare. It's like, hey, how's it going? How's your day going? What's going on with your job? So that's the rapport that I bring to the table, building that relationship with someone, because I'm your trusted advisor, not just today, but through the future. And I think how important that is. And like you said, helping these families understand Medicare is confusing and overwhelming. And I can help you by, making it not confusing, not overwhelming. And I think that's where we make a positive difference in everybody's life.
I said I'm going to break the show into 3 parts. The second part is enrollment. Open enrollment's right around the corner, Stephen. Mm-hmm. And people are getting ready to go on Medicare for the first time. And I'm telling you, folks, you're going to see these ads on TV, these national ads. And I'm not going to say the name of the company, but I called one of the companies, not once, I called them 4 times. I got 4 different quotes from the same company. I mean, that's got to be embarrassing. And you know what? Those are national ads. It's so much better having someone like Stephen's telling you. He's going to get to know you. He's going to get to know your needs. These people on the phone are order takers. I mean, that's the best way to describe them.
It's again, they're captive agents. They work for that one carrier. I will say this to my VA, Jackie, just texted me. She's like, "You mentioned my name on the show." I'm like, so she's all happy. She's in the Philippines. And we just mentioned her name on the show. She's all excited. So yeah, don't be persuaded by these commercials because unfortunately they're misleading. I'm going to just say that they're misleading. And the benefits that they're talking about for you, they sound great. And maybe they're great for you to a point. But have they done the due diligence to see that all your doctors are still in network, that your hospital you want to go to is in network, or all your medications covered? Just because you might get some extra money for a food card doesn't necessarily mean it's the best plan for you that's going to meet your healthcare needs. Because I think that's the most important thing. Does the plan meet your healthcare needs and your budget? And that's how we're going to determine what works for you. Not whether you get a food card for $100 or $200. I know that might be helpful for some people, but in the bigger picture, your doctors need to be covered, your hospital, your medications. Those are the things we're going to look at. We always do our due diligence with every family we speak with.
Stephen, I got to tell you something. I haven't shared this with you yet. I get one of those food cards that I think I've got like $35 a month, but I got to tell you, a friend of mine said, your company offers you other benefits that you could get a credit card on all these different stores and restaurants. And I said, what are you talking about? And they took me to the website. My agent never told me about that. Our big store down here is Publix. I ended up getting $80 from Publix that I never even knew about. And then I got a $20 restaurant gift card. But my agent never told me about that on top of the $35 I get every month. He should have told me that.
And that's the difference. That's the difference with taking that extra step, educating you on why this Medicare Advantage plan. Okay, we talked about your doctors in network, your medications are covered. You like this hospital? Okay, it's in network. Now let's talk about some of the ancillary benefits, the dental benefit, the vision benefit, the hearing benefit. Oh, by the way, there's some benefits called over-the-counter benefits. And these over-the-counter benefits include, for example, food card or going to Publix, which since I've been down south happens to be one of my favorite stores, Publix. They have a really good bakery section. They shouldn't go there though. These are the things that we're going to do for you. We're going to walk you through. And maybe when I go through the plan on one of the platforms we use, it doesn't show me everything. So we're going to go to the carrier website to cross-reference what I'm seeing and what's on the carrier website, because there might be something that's been omitted, what I see on one of our platforms. And by cross-referencing it on the carrier website, we can say to you, oh, by the way, Steve, did you know you get this at Publix, or you get this restaurant gift card? Now, again, I'm limited to what I see on a platform. That's why I always cross-reference, because there'd be more benefits that I'm not aware of, and that's my job, to make sure you're aware of everything.
I got to tell you, first of all, Stephen, your show goes by too fast. And what's really funny, I'm saying that 2 people just wrote in, how come the show is only 25 minutes? Hey, listen, Ask the Experts is a busy show. We do this 5 days a week. Stephen's with us. We do a New Jersey show. We also do a show for Florida, the whole eastern part of the United States. And then we do what we're doing today, our California show. Stephen, tell people how they can reach you.
Sure. Well, the first thing is they can call. I'll just give you my business cell, which is area code 908-268-2356. They can also go to the website, which is www.fromme.com. And on that is a contact sheet. They can fill that out and get in contact with us. And my new virtual assistant, Jackie, will be happy to reach out to them to schedule our one-on-one consultation. And that is basically the 2 easiest ways to get in touch, as well as they can always call the 800 number, which is 877-801-4440. So there's always ways to get in touch with us.
So, Stephen, I got to share this with you before we go off the air. All of a sudden, because I've got my TikTok on my cell phone, I've got our show with our 70 platforms on my laptop. All of a sudden, confetti started coming out all over the place on my screen. And I looked up and it said, I've got 5,400 and something likes for your show. I have never seen that. I mean, we've only been with TikTok for 3 months now, but all of a sudden, all this confetti start flowing down. And I looked up and it said 5.4K, which is 5,400 something likes. I'm so glad people love the show. It gets better. We're getting closer to enrollment time, and it's so important that you have a great agent, not just an agent, a great agent like Stephen Fromm. Stephen?
Open enrollment real fast. Open enrollment October 15th through December 7th. So now is a great time to reach out to us to begin to talk about open enrollment and how we can help you make a positive difference in your life.
And I'm going to share with you, when Stephen comes on again, what happens if you don't enroll on time. There's penalties. Trust me, I know about them. Stephen, bro, travel safe. We love you, man.
I will. Thank you very much. I appreciate it. You guys have a fabulous day.
That's Stephen Fromm. Folks, I'm telling you, this is Medicare time. It's almost time for enrollment. Give Stephen a call. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.